previous discussion, we were able to identify the frontal bones, and we went deep into it to identify the structures within the frontal. And with us today, we shall be learning about the facts about the parietals. The two parietal bones are large quadrilateral, which is four-sided bones that form the greater portion of the sides and roof of the cranial cavity. Each bone articulates with the opposite parietal and other skull bones, including frontal, temporal, occipital, and sphenoid. So we did with frontal, and soon we'll be getting to know about the temporal, occipital, and sphenoid, which are in close contact with the parietals. The inferior border forms a bivalved articular surface, while the anterior, posterior, and superior borders form deeply denticulate or tooth-like articular surface. The external surface of each of these bones is slightly convex, while the internal surface is concave. These are the facts about the parietal bones. Then we have the internal surfaces of the parietal bones contain many protrusions and depressions that accommodates the blood vessels, supplying the dura mater, the superficial membrane, meanings covering the brain. So these are the parts, or just a brief description about the parietals. So for this bone, we have this skull, which is drawn from the lateral aspect, and the parietal bone is the part labeled 19. And we have few surface landmarks or few surface features of this bone as 18. 18 is the inferior temporal line, then 17 is the superior temporal line. We as well have other bones of the skull, but let's majorly deal with those which are in close contact with the parietal as this temporal bone. And for the temporal bone, it contacts with the parietal bone at this suture known as the squamosal suture, and as well as lambdoidal suture, which is, let me just take you to that suture, which is this part labeled 24, which is the parietomastoid suture. We as well have other bones which are in contact with the parietal as frontal bone, and comes into contact with the parietal at this point known as the coronal suture. We have the sphenoid bone, and we have the occipital bone at the back. This is the same structure of the skull, and the parietal bone is just right here, and this is the endocranial surface of the parietal bone. We have the coronal suture, which contacts the parietal bone with the frontal bone. We have, this is the temporal bone, and we have the occipital bone right there. So let's move to the disarticulated parietal bone. And for us, we have some structures within the parietal bone. As part labeled 6 is the parietal foramen, part labeled 8 is the sagittal margin, 9 is the occipital margin right here. Then we have the part labeled 10, which is the frontal margin, 11 is the squamous margin, then 13 is the groove for middle meningeal artery. So as we have seen, we were told that the parietal is a quadrilateral bone, and that brings us to these angles of the parietal. And for the first one, we have the frontal angle, which is located at bregma, and that is the craniometric point at the junction of the sagittal and coronal sutures at the top of the cranium. We have another angle, which is sphenoidal angle, where the sphenoid, parietal, and frontal bones converge. The occipital angle is located at lambda, that is the intersection of the sagittal and lambdoidal sutures. Then we have the mastoid angle is located at insertion, where the lambdoidal sutures contact the temporal. So we have the two bones, but they are the same, only that this is the parietal on the ectocranial, while this is the parietal endocranial surface. Those angles which we have been able to identify, we have the first one being the occipital angle right here, frontal angle located right there, and we have the sphenoid angle, and finally mastoid angle. Other structures within the parietal, we have the parietal striae, inferior temporal line, superior temporal line, and the parietal tuber, which is the point of ossification for this bone. The endocranial surface, we have the middle meningeal grooves, the arachnoid foveae, the sagittal sulcus right there. Then we have the sigmoid sulcus, which is found right there. So let's move to the description part. The temporal lines donates the ectocranial surface, arcing anteroposteriorly. Then the superior temporal line anchors the temporal fascia. The inferior temporal line indicates the most superior extent of the temporalis muscle. So these are the muscles of the head. The parietal foramen, located closely to the sagittal suture near the lambda, it transmits small vein through the parietal to the superior sagittal sinus. The parietal striae, they pass the posterior superiorly for some distance on the ectocranial surface of the parietal. So let's just review those markings. We have the parietal tuber, which we will be discussing, but we have just discussed about the superior temporal line and the inferior temporal line, parietal striae, which are the lines right there. And those are still other angles of the parietals. So the meningeal grooves for the middle meningeal arteries dominates the endocranial surface of the parietal. The sagittal sulcus is made when parietals are articulated, and the shallow grooves along the sagittal edge of each parietal combine along the endocranial midline. So that's the point where we find the sagittal sulcus. Arachnoid foveae are concentrated endocranially along the anterior extent of the sagittal edge of each parietal. So let's get to review. So we have the meningeal grooves, which are these lines. We have the arachnoid foveae right there, sagittal sulcus, sigmoid or transverse sulcus right there. So we have the sigmoid sulcus. This crosses the mastoid angle of the parietal, cutting a groove on the endocranial surface. It marks the course of the transverse sigmoid sinus that drains blood from the brain. The parietal tuber is the large rounded eminence centered on the on the ectocranial surface of the parietal. It marks the center of ossification of these bones.